biobanking. And our presenters as well will go through, I suppose, an approach to preparation for accreditation, keeping in mind that we're very aware a lot of you haven't been involved in accreditation before, and this hopefully will be an aid for you, I suppose, to start on your journey for accreditation. It's not meant to be a training course today. Obviously, we don't have enough time to do that, and training to the standard, would take a significantly larger amount of time. But, it's just a starting point, and a starting point for everyone. And we hope it will be of use. And then I'll come back in again later on just to go through the mechanics of the accreditation process in INAB, and to give you some idea of what to expect, I suppose, as you interact with INAB over the coming period. So I'm delighted to introduce our two speakers today. The first is Miss Emma Snapes. And Emma is a biobanking consultant, and she has over 20 years of experience in creation and management of biological and data collections for various species. She's an award-winning expert in ISO biobanking standard development, and she's also the Irish head of a delegation to ISO working groups responsible for the publication of ISO 20387 and other biobanking standards. And I'd also like to welcome Mr. Sean Naughton. And Sean is a specialist medical scientist with the Galway Blood and Tissue Establishment. And he also has an extensive background in the collection, testing, processing of substances for human origin and human use. Sean is an assessor already with INAB in the area of blood transfusion in the ISO 15189 scheme for medical laboratories, and he's also an adjunct lecturer in the College of Medicine, Nursing and Health Sciences in NUI Galway. We also have other assessors which I'll introduce later in the process, but I'd like to thank Sean and Emma for joining us today and sharing their knowledge and experience in the whole area of biobanking with all of us today. So the agenda, and just to give you an outline of what to expect for today, I'll bring you through, as I said, a brief introduction to INAB itself. Emma then will bring you through, I suppose, the concepts and origins of ISO 20387 and the implementation of the ISO 20387 standard in a biobank. Sean will bring his experience, I suppose, in terms of implementation of quality systems in organizations, and will bring his knowledge and expertise from there, and hopefully that will be of use. And I suppose it's an aptly named presentation, Where Do We Start? And to give some pointers, I suppose, for anyone listening as to how to start the process of accreditation. And then I'll just come back towards the end then just to bring you through, I suppose, the mechanics of INAB accreditation, where it starts, what to expect. And Joanne Coyle, who you'll see as one of the presenters as well. She's one of my colleagues in INAB, also an INAB assessment manager. And Joanne will monitor and will help in the Q&A session towards the end of the presentations. So just a couple of points to note. The timing for the day, so we've assigned about 2 hours this morning, and I think the presentations will probably take between an hour and 15 minutes. And hopefully all of you can see a Q&A panel in your screens, and please submit any questions that you have through that panel. And if you can, avoid questions that relate to specific cases or individual examples, that would be great, because we can't answer any specific questions to particular organizations. And if you do know, or if you wish to direct your question to any one of the panelists in particular, that's useful information for Joanne when she's directing questions towards the end. And please include your own name as well, if possible. That would be great information for us. And I just want to let you know as well that this webinar is being recorded, so that's important that you're all aware of that. And That's to ensure it's there as a resource for anyone else that might want to have a look at the information, or indeed for yourselves if you wish to go back on any of the information that you've heard or seen today. We think it'll be a useful resource for those as you go through your journey to becoming accredited. And I'm glad to say, I suppose biobanking, most of you on the call aren't going to need reminders that biobanking is applicable to all biological materials. And I'm glad that this morning we have a good attendance, and it is representative of a variety of biobanking applications: human, animal, plant, viral, bacterial. And I'm really delighted that all sectors are represented here this morning, and available, and I suppose interested in hearing how the scheme has started and where we are at the moment in Ireland. Okay, so just to bring you through, I suppose, INAB itself, and bottom left icon or box there. The INAB executive consists of a staff of 16, so we're a relatively small organisation. The manager of INAB is Adrian Duff, and there are 12 assessment managers like Joanne and I, and we have some administration staff also. There's an independent board in INAB as well. They're not INAB employees, and that board represents, I suppose, a cross-section sectors in which we provide accreditation in Ireland. The INAB board as well is the decision-making body in INAB, and they will make decisions on any new applicants, new areas of accreditation, and significant changes to existing organisations. So that's important to know, that they are the decision-making body within INAB. INAB since 2014 is part of the Health and Safety Authority, and then in turn we sit under the Department of Business, Enterprise and Innovation. And there is an EU regulation around the whole area of accreditation. It's EU Regulation 765/2008, and INAB is designated as the sole accreditation body for Ireland by the Department of Business, Enterprise and Innovation. And again, forgive me for those that are already accustomed to accreditation and are working in accredited organisations, but to reiterate, and it's good, I suppose, for us all to go back and remind ourselves, accreditation is the formal attestation of the competence of an organisation to carry out specific tasks according to a standard, and a harmonised standard. And it is an independent third-party peer assessment. And if you look at where INAB sits in the overall organisation within Europe and internationally, we're signatories to the multilateral agreements for within the European Cooperation for Accreditation and the International Laboratory Accreditation Cooperation. And for those that may be interested, the multilateral agreement for biobanking is currently being developed, and hopefully that will also add to the scheme over the coming number of years. However, INAB will proceed, and we will accredit organisations according to the standard while that's being developed within the European Cooperation for Accreditation and also the international organisation. And I suppose the whole theory behind all of this is that if you're accredited once, you are accepted everywhere, and the mark and the logo and the accreditation symbol allows you to be accepted everywhere once you're accredited in and with one accreditation body. So why become accredited? And I suppose I'll start with, ISO 20387 and the biobanking standards. It's voluntary in Ireland. There is no requirement for any biobank to become accredited. And, that's a choice that, hopefully some of you will make. And I suppose what I'd like to do is just maybe bring you through some reasons that might encourage some organisations to become accredited. So I suppose it is, yes, the assurance of the competence of an organisation. And the logo and the mark can be used for marketing purposes for your organisation. inside and internationally, within Europe or internationally. And the accreditation is also used by a number of competent authorities in Ireland in aiding the implementation and monitoring of the implementation of regulations and directives. And some competent authorities are currently using accreditation as a means to do that. And, you know, we would work quite closely with the EPA, the Food Safety Authority of Ireland, and the Department of Agriculture. These are just some examples of competent authorities that we would work with. In theory, because of that, the accreditation and the symbol of accreditation will remove and should remove barriers to trade with other EU members and internationally. And so we're hoping that, you know, as organizations start to become accredited in this area, that you will see some of these benefits to becoming accredited over the coming number of years. And one important point to note, I suppose, is, you know, we're conscious that all of these systems, all of these organizations, biobanks, they're dependent on human input. And, you know, as such, accreditation does not guarantee that every output meets requirements all the time. It does assure competence of the people and the system. However, we all understand that they're human systems and that every output does not meet requirement. However, the competence and the assurance is there that the people and system are capable of meeting the requirements as laid out in the scheme. So I suppose the scheme itself, accreditation for biobanking, it's a new scheme for us, and we've only just launched it in April recently. And it is also a new scheme worldwide. And from what we know at this point, it seems as if there's a couple of accredited organizations in the US. There aren't any accredited organizations yet in Europe. However, we know a number of our colleagues in Europe are looking at bringing on some applicants and are looking at this scheme and developing this scheme in their own accreditation world, I suppose, at the moment, and we will be keeping in close contact with them on that. Other considerations that are important to know at the start, and the first bullet point there is taken directly from the standard, in that the biobank shall be a legal entity that is legally responsible for all its activities. So I suppose that's one place to start for anyone that's embarking on accreditation according to the standard, in that that's the first thing, and one of the first things to consider is what is your legal entity and who is legally responsible for your activities. And the other area just to draw your attention to is also, if there is, and there isn't in all cases and with all biological materials, if there is a legal framework in Ireland, our assessment teams will be taking these legal requirements into account as well as we progress through the accreditation process. And as I said, that's not the case in all areas. However, where legal requirements do exist, they will be incorporated into our assessment processes. So the next slide then is the scope of accreditation. So we've been discussing this quite a bit as a group of technical assessors over the last few months. And this is our direction, I suppose, and where we're going with how to define the scope of accreditation. And the scope of accreditation is really what a user will see if they, for example, go onto the INAB website of an accredited organization and an accredited biobank. They will see the biological material on the left-hand side, which human, animal, plant, viral, etc., whatever is applicable to the organization in question. And what we've tried to do is break down the scope elements that are involved in biobanking, from acquisition, collection, right through to distribution. And I've highlighted two areas there in yellow, and that's what the view is, that they are the minimum requirements and competencies that must be in all biobanks. If you're storing samples, that we will assess the competencies in those areas specifically, and they will be minimum requirements. And however, for all of the biological materials that you're storing, the expectation is that all parts of the life cycle of the biological material in your biobank will be accredited. And we will assess all parts of the life cycle of any of the materials. So it really does depend, and the scope can be tailored depending on what your biobank does, the type of materials, and what the biobank function is for the particular samples that you're holding at any particular point in time. This scope also allows us, I suppose, to match the expertise of the assessment team as well to your organisation. And just to go back on, it is a peer assessment, and so we do want to ensure that for your biobank and your organisation, that the technical assessment team is competent in your area and your technical area, and this defining the scope of accreditation for your organisation then just helps that process as well. Okay, well, that's it from me for the moment. I'll come back to you later when we're going through the accreditation process, and I'll hand over now to Emma. So Emma, I'll let you take it from here. Thanks again, and we'll talk later.
Excellent. Thank you so much, Breed. It's really, really wonderful to be here this morning for this inaugural launch of the INAB accreditation scheme for ISO 20387, the newly adopted biobanking standard. I know that many of you have already contributed content, opinion, and comments for the standard itself, and so are already very familiar with the document and its applications for biobanks relevant to research and development. But I'm cognizant too of attendees here today who might be entirely new to ISO standards. So with this in mind, I wanted to outline a possible approach in order to help a biobank determine, first of all, if it should implement the standard. Either it's in its entirety or even in parts. So I thought I'd put myself in the place of somebody with a biobank interested in doing exactly this exercise. So you will see this diagram right throughout my presentation. So forgive the repetition, but I just wanted to point out the various steps or stages that might be involved in such a process. So the first thing, number one in the green section there, that I would do is to move to identify what a desired state for my biobank might look like. So that could differ hugely from biobank to biobank, depending on the sector or domain of operation, the resources available, and the biobank's current mission. So possible desired states would include implementation of the standard in whole or in part in order to satisfy the driving stakeholders. So maybe what I should be asking at this stage is, who are my driving stakeholders for this exercise? So new biobanks could maybe use the standard to address requirements as they arise, and whereas maybe more experienced biobanks will at least already have some framework of quality elements, if not a quality management system itself, upon which to address the biobanking specific requirements and related competencies. So it's only, however, by addressing all of the requirements of 20387, so that's complete implementation, can a biobank demonstrate conformity to the standard and then move to be assessed by INAB for accreditation. So I would look carefully to evaluate then my biobank's current state, and that's number 2 in the blue. And I would use the delta or the difference between the desired and the current states then in order to determine my areas of focus in number 3. So that's the time then to set goals or targets related to the standard. So obviously those goals should be relevant to the biobank. They will need to be realistic, and they should also align with my biobank's business goals. So a resulting implementation plan then can be formulated in order to address the areas of focus and maybe address specifically to bridge the gaps that might have been identified. So meeting the requirements and preferentially also the recommendations within the standard where they are applicable to the biobank. So in step 5 then, I would include a system of monitoring to accompany implementation, allowing sufficient time and systems to examine, reflect, and even if you need to adjust accordingly, will help with risk management during the implementation process. So I will go through each of these steps in more detail, but first I want to point out to the fact that ISO 20387 does actually not exist in isolation. So what is there to help me with the implementing the standard? Because the standard is so new and in recognition of the potential complexities of its application across very different species domains, a technical report called ISO TR 22758 was written and was published just last year to help clarify some elements of the standard. So ISO 20387 is the international standard, and the biobank needs to conform to the requirements within that standard in order to move to conformity assessment. Then ISO TR 22758 is a report without any requirements. It provides guidelines, clarifications, explanations, and examples to help interpret some of the standard. So it is simply there to act as an aid for implementation of ISO 20387 requirements. And it's worth noting that it's applicable to both newly established emerging biobanks as well as existing biobanks. So returning to the diagram itself then again, of critical importance to the identification of a desired state is a constant vigilance by my biobank. That's required to remain in line with the obligations that exist. So those include the ethical frameworks that might apply, and then any local, regional, national, and international regulations, and such as GDPR, amongst many others. So many of these can be considered as living documents with changes and updates and even amendments created in response to different technologies and societal changes. And a biobank's legal and ethical framework will form the core structure for the biobank operations. So it's worth noting that such regulations and obligations are not included in the standard, because standards, as Breed already has said, are voluntary. So ISO 20387 as a conformity assessment enabling standard, it can be described as having 3 separate but interdependent or interlinked requirements. So these include biobank specific requirements, technical requirements, which are often referred to as competence, and management system requirements, specifically a quality management system. So by addressing the trinity of requirements of 20387, that's complete implementation, a biobank can demonstrate conformity to the standard and then move to be assessed for accreditation. So it's the combined implementation of those 3 different types of requirements that a biobank can really demonstrate increased robustness and increased confidence then for within its biobanking operations and for the resultant output. So it's possible, of course, then to consider implementation in an incremental fashion, where a biobank moves to address the requirements in a stepwise manner in order to fit with resource availability. So it's important, though, at the same time then to align the biobank's vision and roadmap. So that is to identify the desired state initially. So then, in order to move on, it's a good idea to actually look at where you're at now. So in evaluating my biobank's current state, it needs to be done in respect to the needs and mission of the biobank, but also to what is happening globally. So we're very familiar at this stage with, what's happened over the last year or more, and we've seen unprecedented global changes that have impacted organizations worldwide of all types, and that have changed the landscape of operations for those. Despite the fact that biobanking then is a central cog in research and in much of research and development, there are actually very limited metrics available to biobanks to help demonstrate a commitment to quality and to interoperability. So it could be useful to look for new opportunities to inspire confidence for those stakeholders who need this the most. So a biobank can undertake then an in-depth assessment of its operations, particularly those that impact on output. And that would be a case of looking at all its biological material and data, its collection or collections, and determining how the contributing processes and activities impact on key indicators. And you need to consider resources for this, both financial and others, such as personnel. And commitment of personnel is something that really does need to be secured. But also, whilst considering implications of implementation, maybe you should also consider implications of non-implementation. Now that the standard exists and others will be applying it to some extent, at least, even if not quite to accreditation, how will that stand within how will your biobank stand then against when in comparison to those biobanks? So having evaluated then both the desired and the current states, I should now be in a good position to ascertain what to focus on. So ISO 22758, the implementation guideline, it states that a gap analysis can be gap analysis of the biobank's current practice against the standard requirements can be beneficial. And there are a number of methodologies in order to conduct, that can be used in order to conduct a gap analysis. So I've provided a couple of examples here. A SWOT analysis is compilation of your biobank's strengths, weaknesses, opportunities, and threats. It's a simple tool, but it can be effective when it's used to its full potential. And it really depends on being extremely honest about your capabilities. But it helps to build on what is done well and to address what is lacking and to minimize risk, as well as to help better position you in order to take advantage of the opportunities that do come along. So RCA is root cause analysis. It's a collective term that describes a wide range of tools and techniques that can be used to uncover causes of problems. So these and other gap tools can be used then to let me know what the gaps are, where they exist, and hopefully why they are present. So ISO 22758 also goes on to say that a gap analysis can lead to a plan of implementation of requirements. So it's important that such a plan has parameters as with any project, so that you do need to know what the defining limits are. And one of those obviously is going to be the scope of your biobank. And Breed has already described how a biobank would need to use a selection process in order to define and examine and to declare the biological material and data, as well as the associated processes and critical activities that are involved in impacting on that, on the output. So another parameter obviously is going to be the types of requirements and recommendations within 20387. And key to that then is understanding the underlying concepts of 20387. And I have a couple of them listed here, not all of them at all, but impartiality, confidentiality, some of you will be familiar with those through other ISO documents already, critical activities, and most pertinently for biobanking, fitness for the intended purpose. So clause 3.24 provides a definition and useful note then to explain fit for purpose or fitness for the intended purpose as a central underlying concept of 20387. So it's in line with pre-arranged requirements. And the definition of such requirements then can take place either within the biobank itself or in collaboration with users, and should consider analytical and other relevant criteria. So the ability to deliver fitness for the intended purpose and its demonstration, of course, as well, is dependent on a number of factors, such as biobanking infrastructure itself, the facilities that you have, the resources, both personnel and others, as I've mentioned, the processes and the knowledge that is available. So I provided here some of the criteria that might be appropriate for fitness for the intended purpose consideration. So some of these are predefined obligations that were already mentioned. The applicable legal and ethical framework, as well as a combination of user-defined and biobank advised specifications. So fitness for the intended purpose criteria for each biological material and data needs to be considered and ideally initially established first at the biobank project design phase. But it also needs attention throughout the various stages of biobanking, particularly where an activity or process can impact on the fitness for the intended purpose. So figure 1 of the implementation guideline 22758 shown here traces the progression of a biological material and data, and the potential then for continual revisions of the definition of fitness for the intended purpose. So you would have to retain documentation for all steps. So whilst figure 1 is represented here as a linear progression, it may look entirely different for your particular biobank. Stages could be repeated, skipped, or be present in a completely different order. So the customization of the biological material and data and its intended end use can then further be supported by continual refinement related to fitness for intended purpose by both the biobank and the user. Now, where the user is not yet identified, fitness for the intended purpose then can pertain to a projected or anticipated range of end uses. So you may need to think about how biobank resources are best deployed in the most optimal way in order to achieve fitness for the intended purpose for either maybe the majority set of users, or even for a primary use. So that's dependent on the biobank's output. So at this stage, for stage 4, for application of solutions, it's time to determine the roles and the responsibilities and even the relationships involved. So it's important to have a good communication platform, because once implementation is adopted, effective communication then will allow personnel to understand the strategy and their particular role in it and how it will be performed. It's so that ownership really will be will be there on behalf of the implementers, so that they will really feel part of the whole process. It'll be a feature, and this will nurture a mindset then of ongoing quality and improvement. So it's important that you get feedback where you can, then from verification and validation processes, directly from the personnel implementing the goals, because these are all fundamental to the demonstration of conformance. So finally, once implementation is underway, I would look to monitor progress and provide continued support. It's a chance to evaluate that implementation is aligned with the defined mission and the strategic goals of the biobank, and to ensure that it's still realistic. It's really an opportune time to ask if the implementation of the requirements and the other changes serve to further increase user confidence. So you need to come up with a set of questions that pertain to your desired state. Perhaps they could be, do the potential users have a basis to assess fitness for the intended purpose? Does the quality management system really address quality policies and objectives in order to demonstrate the efficient use of resources, to help mitigate risk, and to increase the robustness of operations? Perhaps you need to identify whether technical competence is a feature and is it evident for stakeholders? And most importantly, then, whether the changes have impacted on the biobanking output, allowing perhaps for improved cooperation and exchange of biological materials and data with different groups, and to ensure that interoperability is a key feature going forward. So implementation is iterative. The processes can change mid-course, and you can have unforeseen issues or challenges arising. So sometimes those original goals will need to shift as implementation is realized. So it can help here to be attentive and flexible during the implementation, and to communicate the need for this to others who are also involved in the process. Because a willingness to change or even to readjust plans based on what is happening as you see implementation can be more beneficial than just blindly adhering to the original goals that were established earlier on. So that's agility within the biobank system may help to support implementation, and therefore could become an important feature of your quality management system that supports the biobank. So in fact, a quality management system that incorporates and enables monitoring through internal auditing will provide a strong foundation to achieving fitness for the intended purpose. So that concludes my discussion of a structured 5-step approach to the implementation of the standard. So to refresh briefly, the stages are to identify your desired state, evaluate your current biobank state, determine the areas of focus that relate to your biobank, apply the solutions, and continue to monitor, examine, reflect, and adjust. I'd like to thank you very much for your continued attention, and now I will hand over to Sean.
Good morning, all. Thank you, Emma, for a wonderful presentation, and as well to Breach for the earlier introduction. My name is Sean Octon, and I'm delighted to have the opportunity to present to you this morning. My presentation is particularly aimed at those of you at the very start of your accreditation journey. It can be or seem to be a very daunting place to be, And I hope I will be able to make it seem a little less so and show how accreditation is actually very achievable over time, and as well provide a little or a gentle introduction to some of the key concepts. So where do we start? I like to bring it back to this old metaphor, how do you eat an elephant? And the answer, as always, remains one bite at a time. So in this case, your elephant is the accreditation journey. You know already you cannot achieve it all in one go, but you can have a focus on having a system to prioritize where you're going to start. So you can identify smaller, independent, achievable tasks. Complete one, move on to another, building on your previous accomplishments. And this way you're taking small bites of your elephant as you move along your journey. I'd like to suggest that you start with a process flow. So what is a process flow? First of all, we'd ask that you identify your BMAD. Now, BMAD here refers to your biological material and or associated data. So identify the BMAD that you wish to accredit. Identify the intended purpose of the BMAD, taking particular focus on the fitness for purpose as Emma spoke about in the last presentation. And then develop a process flow, which is a diagrammatic expression of the biological material and data as it flows through your facility, from its collection and acquisition right through to storage and distribution or disposal. Then try to tie this process flow to the scope elements for which you want to achieve accreditation. And ask yourself which scope elements apply to your processes. So the scope elements, Breach went through them earlier, but just to quickly recap, they are acquisition and collection, preparation, preservation, storage, testing, distribution, and other. So in this process flow example here, we follow a BMAD through a biobank facility. So you start with your collection and acquisition protocols, and that results in you having your input BMAD. You carry out your preparation or your preservation methods as they apply, and this results in an output biological material and or data. You may carry out various testing on this BMAD, and it may result in various measurements. You may then store your BMAD, and perhaps on receipt of an access request, you may distribute it to your users. So that's a very generic process flow example. Now, if we look at overlaying the scope elements as they may apply to this example, you can see I've highlighted them in green. You're looking for accreditation of your collection and acquisition, your preparation and preservation methods, any testing you might carry out, your storage conditions, and your distribution. So as you go through this process with the biological material that you wish to achieve accreditation for, you will of course have some differences. Some may all apply. In some cases, only certain elements may apply. Now that you have your process flow, let's look at some of the key quality management system areas to help you get started on your accreditation journey. And as we go through these, keep in mind your process flow for your facility. So we look at document control, validation and verification. We look at competency, non-conforming output and corrective action, internal audits and continual improvement, and the report or certificate formats. So document control. What is document control? Well, it's a system that can ensure that your documents are reviewed for adequacy and are authorized by appropriate senior personnel. It can also ensure that there are periodic reviews and updating of your documents and procedures to ensure they remain reflective of current practice in your facility. The system also includes a process for review of documentation and review of changes and how to approve changes. it also ensures that the current revision of the documents is identified. And this is a process known as change control. All documents will be uniquely identifiable, and document control can also prevent unintended use of obsolete documents or revisions, so out-of-date work instructions. I think it's very important to remember that there are many examples of document control systems out there already, and there are many different ways of meeting the standard. So bear in mind there is no need to reinvent the wheel when it comes to implementing document control. I thought it would be good as well to include this example that there's also a requirement to control the records that you keep. So there are a few examples here of what a document may be and what a record is. So a document could be a standard operating procedure, work instructions, policy statements, maybe a training presentation, whereas a record might be a training certificate that was issued by you or an external third party. It might be a calibration report or checklist. And there are also many software packages that allow electronic control of documentation and record retention. So going back to your process flow, for each process within your process flow, identify the technical instructions that you already have in place and codify them into a standard operating procedure. Also, identify the instructions for all other aspects of your work, be that from interacting with your quality system to how you perform staff training, how you assess staff competency, to addressing risks and opportunities within your facility. Look at those instructions and codify those also. For each process where you record information, be it in a checklist or a test result, codify the record keeping format. Allow standardization. And ask yourself throughout, when in doubt, how will we ensure the integrity of the quality management system such that there are no question marks over the fitness for intended purpose of the BMAD? So when in doubt, apply document control. So we'll move on now to validation and verification of your methods and processes. So the question here is when to validate and when to verify. So first of all, we'll just define those. So validation. A validation is required for all non-standard methods, right? An in-house developed method or a modified standard method, something that you've modified in-house. And the standard itself gives a definition that it shall be as extensive as is necessary and confirm through the provision of objective evidence that the specific requirements for the intended use of the examination have been fulfilled. And verification. So standard methods and processes. So these could be peer-reviewed methods. They might be a test kit by a manufacturer. It could be equipment operated as per manufacturer's instructions. So these standard methods and processes, they all require less extensive testing prior to introduction in your facility. So that is, they have already been validated. And thus, when you want to introduce them in your facility, they require only verification of their performance characteristics. And this is defined in the standard as confirmation through the provision of objective evidence that specified requirements have been fulfilled. So what needs to be validated and what needs to be verified? So there is an onus on the biobank here to identify all stages of a BMAD's life cycle and the critical activities within each stage of the life cycle. So what's a critical activity? Well, it's anything that may have a potential impact on the fitness for the intended purpose of the BMAD. Whereas the life cycle, as alluded to earlier, is the consecutive and interlinked processes applied to the BMAD within your facility. So that might be collection, accession, acquisition, identification, all the way through to distribution, destruction, and disposal. So the biobank must now identify the methods and processes employed during each critical activity and determine if validation or verification is required. And it's also good to point out as well that equipment and software can, depending on your BMAT, affect the fitness for purpose. So keep that in mind. And I think it would be very good to always bring this back to first principles thinking and ask yourself, does this action, event, test result, process, or equipment potentially affect the fitness for intended purpose? And if so, what is the requirement here? Is the requirement here to validate or is it to verify? Are we using a standard method or are we using an in-house modified method? So we move on now to competency. So within the standard, uh, it's up to you. You must define the level of competence required for your facility and for completion of the particular tasks within your facility. So it is you that set the criteria for competence. Now, it can be very useful to tie competence to initial training plans. So as you bring a new staff member through a training plan and they complete one section, that competency is achieved and is deemed to be achieved before progressing to the next training section. But you can also use a staff member's education, their training, their demonstrable skills and previous experience to deem a staff member competent initially. However, there's also a need to periodically reassess staff in terms of competency to ensure the maintenance of effective competency. So there are many ways to assess this, and some examples include witnessing or observation of work. You may carry out a test or evaluation of knowledge. There might be a review of work already performed, or that staff member may partake in external quality assurance schemes. And of course, keep evidence of whatever method that you use. Non-conforming output and corrective actions. So what is non-conforming output? Well, non-conforming when something goes wrong. So it could be a failure to meet your own or your client's predefined requirements. Maybe an SOP was not followed or a report was not issued. It could be due to inadequate storage conditions. Another example is that personnel may not have been trained or may no longer be deemed competent. So non-conforming here is defined as deviating from a particular requirement. And that might be an ISO requirement, it might be an INAB requirement, it might be a requirement of your own procedures. And it specifically relates to non-conforming output of the biobank. And what you need here is a system for recording and remedying this non-conforming output. So what do you do when you identify a non-conformity? First of all, react, take control of the situation and correct it, or deal with its consequences. Next, evaluate. So identify the underlying cause or causes, and then determine in such that what is the extent of this non-conformity. Do similar non-conformities exist within our system, or do they have the potential to reoccur? And are there associated risks or opportunities now that I've identified this non-conformity and potential underlying cause? So the onus here is to undertake corrective actions appropriate to the effects of the non-conformity that also deal with the underlying root cause. So again, keep records of the nature of the non-conformity, the actions that you have taken, and then assess the actions you have taken to see if they were effective. So root cause and corrective actions. So I think it's important to remember that while non-conformances are detected in non-conforming output, the root cause of the non-conforming output may actually occur in any area of your process flow. So here's your process flow again overlaid with the scope elements in green, and I've now added in the quality management system on top of this. So again, that's elements like the document control, the personnel, training and competency, the validation and verification of your methods, facilities and environmental conditions, etc. And once you identify your root cause, be it within any of those areas, you then carry out your corrective actions. And those corrective actions can range from any number of things, but a few examples include retraining of personnel. It might be a need to amend your procedures. You may have to send a notification to your clients or even initiate a recall of material. And it may end up that you have to carry out increased monitoring or testing. Internal audits and continual improvements. So an internal audit. So INAB assessments, you must remember, they're a one-day snapshot of your quality assessment or quality system. So internal audits are therefore a means of identifying deficiencies within your system all year round. So the idea here is to regularly audit your system to ensure it adequately meets both the requirements of ISO 20387, the requirements of your own quality management system, and your own and your client's technical requirements. So to carry out an audit, start by defining the audit criteria in advance. So that is, know what you're looking for before you start, and ensure impartiality. And by that we mean that the auditor is independent of the activity being audited. And of course, keep evidence of your audit. And in this way, the internal audit will identify and correct deficiencies where your system does not meet requirements, and it will help maintain effective accreditation in between annual INAB assessments. Continual improvement refers to improvement of your quality management system, your products and services. And there are many different ways to identify targets for improvements. And I've listed some of the examples here. They could be a review of staff suggestions, a review of procedures, how you use policies, setting strategic or quality objectives, again through internal audit or external audit. You may identify targets for continual improvement through corrective actions arising from non-conformities, partaking in proficiency testing or external quality assessment schemes, through data trending, and maybe through dealing with complaints from your clients. So the process then will be to identify potential sources of any system weakness or error, and then develop plans to implement the improvement. Implement the plan, often using your change control via your document control system, and then review the effectiveness of the action through a process of focused review and audit. Then, based on what you find, you may need to adjust the action plan and modify the system in accordance with the review and audit results. And lastly, we're going to talk about the report format. So there are some particular requirements within the standard of how you structure your report and what must be included within it. So it could be an idea to begin to look at your electronic systems if they are responsible for issuing your reports. So we say it's good to look at them early to ensure that your reports or the certificates that you issue can comply with the standard. So reports, they can either be electronic or they could be hard copy. And if they are electronic, they can be provided either by electronic data transfer or also by providing access to an electronic database. Reports also need to include a statement to the user that the report may only be reproduced in full, i.e. that your clients are not reproducing abridged or shortened versions of your report or certificate. So what must be on the report? It must have a title, a date of issue, a unique identifier of the report. There must be an identification on each page of the report, and it must be clear to the user when they have reached the end of the report. There is also a requirement to include the INAB symbol or reference to INAB accreditation. And you also have to make clear to your users that on the report of any activity that is non-accredited. As applicable then, You have to include biological material or identification, or specific properties of the biological material, any relevant quality information, the methods of identification or characterization of the material, testing results and the methods used, and then the methods for the collection, acquisition, preparation, or preservation protocols, your storage conditions, and the name and the function of the person who authorized the report. So that's a bit of a whirlwind through a lot of the various concepts there, and I know there's lots to digest within that, but I do want to reiterate that it is very doable with time and taking a step-by-step approach. So with that, I'd just like to say thank you very much and best wishes on your accreditation journey, and I'll hand back now to Breach.
Thanks, Sean, for that, and thanks to Emma as well. Thanks, Sean, and thanks to Emma for that. Very informative, both of them. The hopefully will give an idea of where to start and how to approach if you're starting out developing your quality system for ISO 20387. I'll just bring you through the mechanics really of applying to INAB and how our process works. So I suppose when you're in a position and you've your quality system developed according to ISO 20387, you have it documented where it's necessary to be documented, and you're using it at the moment. Well, then at that stage, you're ready to apply to INAB at any point after that. And we interact with all of our clients through our IT system, the CRM system. And once you're ready to apply, you will have access to our CRM and our IT system. And at that stage, we'll ask you to send in all of the documentation that you've developed, your quality system. And also we'll ask you to clarify the scope of accreditation that you wish to be accredited for at that time and at the initial application stage. And then, you know, based on the scope and the technical areas that you're involved in, we will assign a competent assessment team that will progress your application right through to accreditation. Now, Sean and Emma are going to be both on the INAB assessment teams, depending again on the type of area and type of biobank that you're operating. And at this stage, I'd also like to introduce a couple of other assessors that we have available at this stage. And Morris, who you should be able to see on your screen there. Morris, I'll ask you just to give a quick introduction to yourself, if that's okay.
Yeah, sure, Bridge. Hello, good morning, everybody. Morris Bardsley. I'm based in the UK, in southwest of London. Bit of background about myself. In the last century, in the 20th century, I worked as a materials chemist for the UK nuclear submarine fleet. And then in the 21st century, I jumped ships and worked for DEFRA UK, managing a biobank of TSE, transmissible spongiform encephalopathy, samples from the BSE crisis in the 1980s and 1990s. We had about 200 -80 freezers, and I managed that in compliance with ISO 9001. Also, during my time at the Animal and Plant Health Agency, previously known as the Veterinary Laboratories Agency, I was also taking part in an EC-funded project called EVA, the European Virus Archive, now currently known as EVA Global. And since that time, in about 2008, 2009, I've been involved in EVA Global as the quality manager. And we provide reference materials for virus isolates for research and diagnostic testing. And my participation in this was involved around writing a quality standard for the project that was unique to the project itself. So I have a bit of experience in storage of veterinary materials, but also viruses and virus-derived products. I think that's about it. Is that okay, Bruce?
Yeah, of course. Thank you, Morris. That's great. And Pradeep Agrawal, who hasn't logged on as a panelist, I think he's in the audience. So just to introduce Pradeep as well, you may also meet Pradeep during assessments. And Pradeep currently manages a biobank as part of King's College Hospitals, one of the NHS trusts in the UK as well. So again, you know, we have 4 technical experts available to INAB at this stage, and all with differing competencies, experiences and backgrounds, and hopefully we'll be able to cope with any of the applications that we should get over the coming months.
Hello, hello, Brett. Can I come in? It's Pradeep
Yes, you can,
Agrawal.
Pradeep.
Yeah,
Yeah, I can't see
yes,
the attendance list. So
that-
go ahead,
that's
Pradeep.
correct.
Yeah, go ahead.
Yes,
Yeah.
I apologize. I am unable to sit there as a panelist, but I am here. I have listened to yourself. Thank you very much, Brett, for allowing me to speak for a couple of minutes. So my name is Pradeep Agrawal. I work as a director of liver laboratories in the King's College Hospital in London, which is an acute teaching hospital. I have been working as a assessor, technical assessor, with the CPA initially and now UCAS, which is the United Kingdom Accreditation Service, for the last over 25 years. So I've assessed medical laboratories under the ISO 15189 in the UK, but also in Republic of Ireland and abroad. Now, my experience with Biobank is I set up the Biobank in the liver unit at King's College Hospital in 2009. Started completely fresh, just like the journey that both Sean and Emma have alluded us to. And it started very much because what we had were clinical fellows coming into the department, applying for ethical approval and taking consent of patients for their research. And that took nearly 6 months before they could even start their research projects. So what we did was get a general ethical approval to start the research project immediately. So we set up the biobank, as I say, about 12 years ago, and then got it HTA licensed, which is Human Tissue Authority licensed, and it's working very well. We've currently got over 3,000 patients that have been consented for biobanking and collecting human material, obviously, and something like over 15,000 aliquots. These material have been very useful for the research projects that both the medical staff, the clinical staff, and the scientists are conducting for translational research within the department. So the processes have done very well. Resources were identified. I've got a team of 2 to 3 people at the moment working in the biobank, and we are working towards applying for the accreditation under ISO 20387. Thank you.
Thank you, Pradeep, for that. That's great. Sorry, I couldn't see you there in the audience. So thank you for introducing yourself to the group here. Again, I just want to come back to the process again and to remind all of us about, I suppose, the kernel of the accreditation process and what you can expect if you apply to INAB or indeed to any of the other accreditation bodies if you're not based here in Ireland. First of all, you know, the assessment team and INAB has to remain impartial at all times. And of course, any information that, you know, we see or hear during our assessment process will remain absolutely confidential between the organisation and INAB. And I mean, all of our assessors have signed up to confidentiality agreements to that effect. So that's an important thing to state here, that, you know, your interaction with INAB is confidential at all times. Again, we want to focus on if there are any findings or gaps in your organisation, that we raise factual findings, and those facts are agreed with the INAB assessment team on any assessments that you're involved in. So they're not based on opinions, they're not based on anything else other than agreement of what happened during the assessment and the facts around that. Again, another important thing to stress is, you know, there's a lot of discussion around best practices, good practices, poor practices. We focus only on assessing conformity to ISO 20387 and the mandatory INAB policies that are in place. So really, requirements are laid down in these standards and policies, and that's how we, I suppose, assess if the organization is in compliance or not. We also try as far as possible to ensure we're consistent with our colleagues in EU and as well as that internationally. And, there are quite a lot of networks ongoing in the various technical areas, and there is a biobanking accreditation working group currently set up within other European Cooperation for Accreditation body members. And we're members of that, and this is how we intend, I suppose, to keep in contact with our other peers in the EU and as to how they're approaching accreditation, and hopefully making sure that we're all approaching it in a reasonably consistent manner. There will be some differences, but we try and minimize that. I suppose through the process, we'd like it to be an added value to your organization through discussions with whether it's your lead assessor or your technical assessors, and that hopefully you will benefit from any of the assessments or on-site visits that we're doing with any of our applicant organizations. We do spend a lot of time assuring the competence of assessors, and that competence of assessors matches your scope of application and the work that you're currently doing. And that's very important to us. And we do, I suppose, place a lot of emphasis, time in ensuring we have the correct assessment team. And we want to make sure it's a peer assessment of your organization. And then through monitoring things like findings, reports, feedback from our clients, we ensure and we try and ensure as possible, it's a human process, but we do try to make sure that there's consistency of our assessment practices and consistency of what our assessors are telling you. Again, just coming back and reminder around the scope of accreditation, and again, the minimum requirements for accreditation, and ensuring that the scope of your accreditation covers the life cycle of any of the biological materials and or data that you're holding in your biobank. And an overview of the process then is here, and all of this information, and there is more detail available on our website, and that's publicly available to all. And it's a document called P7, which is downloadable from our website, and that brings you through, for any organizations, what you can expect. So once you're ready to apply, Adrian will assign your application to one of the INAB assessment managers like Joanne or I. And at that stage, we'll do a document review just to see where you are versus the standard ISO 20387 and INAB policies. And then you have an option at that stage to have a pre-assessment visit. And what that is really is the assessment team will visit your organization for a day and will conduct a gap analysis. Now, it's a bit less formal than an initial assessment, and we do recommend that anyone that's very new to the process of accreditation would take advantage of that day. We're not raising non-conformities. All we're doing is we'll provide you with a written report as to where we feel the gaps are in your organization, if there are any. But again, that's your choice, and you can inform your assessment manager when you're going through the process of application. We then move to the formal initial assessment of your organisation, and that will comprise of lead assessors. That would be somebody like myself or Joanne doing an assessment mostly of the quality system. That's where we would tend to focus. And there will always be technical experts and assessors on the assessment team, and they will concentrate mostly on the technical nature and the activities in your biobank. And they will always, well, at the moment we're doing remote visits with live video links, but hopefully at this at the stage when we're looking at applicants for this scheme, we will hopefully be able to go on site to witness the activity, your facilities, witness your staff completing any of the activities in your biobank. If there are any issues raised then as part of that initial assessment, we agree any issues on the day of the assessment, and then you're invited to give proposed responses and corrective actions to those issues. And then once all of those are cleared to the satisfaction of the team then makes a recommendation to the INAB board. So just go back to one of the original slides, that the INAB board is an independent decision-making board, and they will make the final decision on accreditation within INAB. At that stage, hopefully accreditation is awarded. We send you out your logo, statement of accreditation, etc. And you can put that on your reports or your certificates. And then the organization then falls into, I suppose, our routine assessment, which is a yearly visit to your organization. And then there's a reassessment every 5 years. And again, all of this information and more detail indeed is on our website. So please feel free to download any of the information documents there on the process itself. And so I think that's all for now. And in terms of the presentations, really would like to thank you for your attention going through these presentations. I really hope you found it useful. I'd like to thank the presenters again for putting in the work into the presentations. I think they were really useful, and hopefully you found them useful. And again, it would be great if you can pop any questions that you have into the Q&A panel. And, Joanne is happy to just monitor that for us over the coming few minutes. We still have some time left. So if you do wish to ask any questions, please send in a couple of questions now, and anyone on the panel can answer them. Joanne, I'm not sure if there's any questions.
No questions as such. We're a bit shy on the Q&A this morning. We do have a comment more than a question, just that a BBMRI network biobank is working to ISO 20387, so that might just be a clarification on an earlier comment. I know we did receive some questions via email just from people who couldn't attend this morning, so probably would be a good time to address those now.
Yeah.
And will be aimed more at yourself, Breach. So in terms of applications now for this standard, are we accepting them from today, for example?
Yeah, absolutely. I mean, we're ready to, if anyone is interested, you can contact myself or contact the INAB at inab.ie email address, and you can discuss it or send in a query, and we'll happily have a chat and discuss any queries that you have. But yes, we're open for applications from now.
Perfect. Okay. So we have a new question that's just come in. So thank you first to all the panelists for a very informative webinar. In the case where there are multiple biobanks working within the one institution, should these be considered for INAB accreditation as one institutional biobank?
Okay. Yeah, I can maybe take that one. That's Martin. Thanks, Martin. That's really up to the biobanks themselves. So at the moment, say, if you look at laboratories, we accredit multi-site laboratories within one legal entity, and we also accredit laboratories separately within the same legal entity as well. It really just depends on what the biobank themselves requires. We would always try to encourage people to have multi-site arrangements with their overarching legal entity, which I think cuts down on your INAB costs at least, and makes the assessment, I suppose, a lot easier for us. And I suppose it ensures that you yourselves you have one quality system in place, and that you're all operating to the same quality system. And I suppose that's the prerequisite if it is a multi-site biobank, that's the way it would operate. It has to have a common quality system. Otherwise, if individual biobanks do wish to have separate quality systems, then they would be considered separately while still remaining within the one legal entity, and that's perfect as well. So hopefully, Martin, that answers your query.
Thank you, Breach. So another question has come in. What are common errors made by biobanks while implementing the standard? I don't know who wants to take that one.
Well, you know, for me, we haven't assessed any biobanks, so I'm not the best, you know, maybe to answer that in practice. But I know, say, for example, Emma, you may have worked with biobanks. Sean, you may be working with biobanks. Maybe pick a couple of areas where you think may be common, you know, issues that you see when you're looking at biobanks. Emma, do you want to maybe take or start the ball rolling there?
I suppose really it's not so much an error, but maybe a challenge really is for biobanks to decide what their scope is going to be. And that selection process can be a little bit difficult at times, and until biobanks get their heads around the fact that maybe not all of their biological material and data collections need to be included in the scope. Perhaps just those that are most relevant, most used, or those that are of particularly high value. What it's up to the biobank itself to define that. So I think even the processes that are involved, the definition of biobanking includes the minimum of the acquisition / collection and storage as a minimum, together with other processes. So you do need to consider those processes that are involved, and it's the processes that really impact on fitness for intended purpose that probably should be included for the consideration of scope. And I think really it's trying to maybe assess where a biobank is going and how it will achieve agility, despite even trying to implement the requirements within it, to ensure that it is capable of actually answering the questions for verification and validation as well. Are those processes happening already? Maybe they're not called verification and validation. Maybe they're called testing or quality control or something else. And maybe it's about definition of or redefining what you already do, so that you understand that maybe what you already do is actually in line with many of the requirements. So I think, Sean, maybe you might have something else to offer on this, would you?
Well, Emma, I agree with you fully there, and I suppose kind of linking back to the presentation, I think one of the areas that you might find some errors is more an omission or something that might be an oversight. So if you keep going back to your process flow, I think a process flow and being as thorough as possible in asking the question, does this activity or process or event that we carry out, does this have an effect on the fitness for purpose? And I think what we'll find is most people will identify all of the events that have an effect and identify them as critical activities and therefore validate or verify their processes, but there may be a step that's overlooked. So I think critical importance is going back over your process flow and sense checking it against your fitness for purpose.
Bridget, I can add something to that if you wish.
Yeah, do, yeah, and Pradeep as well, if you wish. Yeah, go ahead, Morris.
I'd agree with Emma and Sean. I think one of my pieces of advice would be to make sure that you don't become too ambitious to start off with in terms of setting your scope of accreditation. Keep it as small and as simple as possible is one option, and make sure that your defined scope of accreditation is only actually looking over the areas that you have direct control over. And so one way would be to start off simple in terms of receipt, storage, preservation and supply of biological materials. And then once you have your quality system approved and embedded and people are used to working to it, then you can possibly consider review with INAB to expand the scope of accreditation for an additional cost, and then take in a broader scope of accreditation. One of my colleagues in the EVA Global project, the Aix-Marseille University, it's actually starting to prepare for pilot assessment to 20387, and they have considered keeping their scope very small, and even so, that's because they're starting from scratch. They're actually finding that preparation of all of the documentation and all of the other areas for the assessment has been quite a resource intensive process. So I think my advice would be to keep it as simple as possible to start with, particularly if you don't have very much in place already.
Thanks, Morris.
Yeah.
And Pradeep, I'm not
Yeah.
sure if you want to come in as well.
Yeah, just a small comment really, that I agree with what the panelists have just said. The main thing, the question that I'm asked when the researchers come to me asking for samples from the biobank is, how can you assure us that the quality of the sample that you're providing to us is fit for intended purpose? And they come up with an application form, and this is the number of samples that we needed for a particular purpose. And what I say to them, look, the quality was assured at the time when we collected the sample. And if they have come from a patient that came to an outpatient clinic and we had a diagnostic sample with it, then yes, we can give you a cross reference or cross match the quality from the diagnostic sample. However, some of the samples that have not been gone through the diagnostic laboratory, because I look after the diagnostic as well as research side, so I'm a bit of a hybrid in that side, in that sense. Then what we say is the quality is as per your whatever is acceptable to the end user, and that's how we overcome the issue about quality control and quality assurance.
Thanks, Pradeep.
Thanks, everyone. So the next question then from Blonid. Can INAB visit and provide advice to institutions in terms of how best to proceed with accreditation according to where the biobank presently is in terms of achieving accreditation? So that one would be for a breach.
Yeah, well, INAB cannot provide consultancy. That's probably, so the answer to that question, Blonid, is probably a no. We can provide training, and we can provide these information seminars that are publicly available to everybody. But unfortunately, no, because we want to remain impartial and independent of the organization that we're accrediting, we can't offer any type of consultancy or individual advice to companies. The pre-assessment visit does offer clarification on the gaps that would be in your system. So it's the assessment team assessing your documentation and seeing here are the gaps. But in terms of directing you or giving you advice on how to fill those gaps, I'm afraid no, INAB isn't in a position. And that's really to protect our impartiality and to ensure it's a third party independent assessment of your quality system. So I hope that answers Blonid. Thanks a million.
Thanks, Breach. You're up again. Thanks for the information today to all of the panelists. Breach, you referred to harmonised standard in your presentation. What is meant by this?
Okay, that's from Linda, is it?
It is,
that's from, there's a list of harmonised standards, I suppose, that's been identified by the EU Commission, and they're the standards that should be used by accrediting organisations and other organisations in terms of how we're implementing a common set of standards. Now, normally INAB only accredits according to harmonised standards. The ISO 20387 isn't currently designated as a harmonised standard, but we do expect, that's a process that's happening at the moment, and we do expect it will be the nominated harmonised standard by the EU for biobanking. So that's in process at the moment. But if you look at the other standards like 15189, 1725 and others in relation to notified bodies, they're all harmonised standards. Hopefully, Linda, that answers your query.
Thank you, Breach. So a lot of questions coming in now. So again, Breach, you're in the hot seat.
That's okay.
What would the cost of accreditation be, as this may dictate if small biobanks can apply for accreditation?
Yeah, that's a difficult one. I can't give you, that's from Sharon, I think, from the name there. I can't give a definite answer to that because it does depend on the scope, the size of your biobank, and, you know, the activities that you're doing. Now, we have a fee schedule and it's available from our website. And in general, there's an application fee, and then there's we charge by daily rate. So it's totally by effort that the INAB assessment team has to invest, I suppose, in your organization. And, you know, for a small biobank, it probably ranges between 5 and 10,000 euro for the initial accreditation process. That would be for a smaller biobank. And, you know, it really extends and increases beyond that depending on the size of your biobank. So if you do want to get a firm quotation, please contact INAB directly, and then we could look at your scope with you and then provide you with a more accurate quotation. So that's just a ballpark figure for a very small biobank. And then obviously it will increase then depending on the size.
Breeze,
So
sorry,
yeah.
I can add something to that if it helps. I know that UCAS have estimated the cost of accreditation. Of course, it depends on the size of the bank and the scope of accreditation. But in the UK, it's estimated approximately 12 to 20k for initial assessment. And I know that in France, it's somewhere similar to what you quoted about between 5 and 10,000 euros. So if that helps, just to give you an idea.
Thanks, Morris. And yeah, again, if anyone wants a more exact quotation, you know, we're more than happy to go through our fee schedule with you and, you know, just to give you a more accurate. So please contact us directly. Thank you.
Thanks, Breach. So a question from Neve. So research biobanks are often funded by grants, which by virtue do not offer stable or consistent funding. Is this likely to be flagged as an issue if undergoing accreditation?
The financial, I don't know, Emma, do you want to come in here? You know, in terms of the standard, I think it is a part of the standard, yes. So
yeah, and it was actually the focus of much debate as to whether even a requirement should be included within the standard, and it really is only asking for a plan, a financial plan. So it could be that you plan to keep applying for funding and with the grace of God receiving it and moving on again. So it's just to ensure that you're looking after the financials and that you're considering all the elements that you need to consider within a financial plan. Just to ensure that you have a strategy there for finance.
Okay, thank you. So the next one then, how can the ISO 20387 standard be integrated into a quality system already in place and certified or accredited to ISO 9001, ISO 17025 or ISO 15189?
Okay, maybe I could start there. You know, we don't have any firm view on this, and in other schemes and in other areas, there are instances where organizations may be accredited to multiple standards and they would have one quality system that meets the requirements of all standards. And, you know, so it's quite, it's possible for an ISO 20387 system to be integrated with other standards. However, it is significantly different in a lot of areas from the standards that you've mentioned there, like ISO 9001 and the laboratory standards. However, the assessment team just focus on if we're accrediting you to ISO 20387, we ensure that the requirements of ISO 20387 are being met. And how you document that and how you ensure that and how you present that to us is really the choice of the organisation, and we're very flexible around that. We don't require separate quality manuals, separate sets of documents for all the standards, but it's really the demonstration of how you're meeting the requirements of the standard is what's important during the assessment process. I don't know if any of the other panelists,
I
yeah.
can add something to that if it helps.
Yeah, go ahead.
No, that I believe I'm correct in saying that 20387 specifically refers to ISO 9001, and I think it allows the possibility for the biobank to negotiate with the assessment body for a light touch in some areas of the quality management system. So if you can demonstrate that you are compliant with ISO 9001, in particular for areas of the quality system, such as things like personnel recruitment, facilities management, etc. There are aspects of the 20387 that may be accorded a light touch by the assessment body if you can demonstrate an intention to comply with, or if you have already been certificated to 9001. It doesn't, I'm sure Emma can elaborate on this, it doesn't specifically refer to any of the other standards such as 17025 or 15189. It just specifically refers to 9001. Emma?
Well, actually, in the creation of the standard, it was initially proposed that it be created as a management system standard, such as ISO 9001. But thereafter, because of the types of testing and the requirements for verification and validation, it was thought that the standard would be more appropriate to be in line with the conformity assessment standards, such as ISO 17025 or 15189. And actually, if you have those standards already in place, you're probably very well set up because you understand the structure of the requirements within the standard. And in many cases, they're exactly the same requirements for impartiality, confidentiality, and the demonstration of the same as right throughout the conformity assessment standards, including 17025, 15189, and 2387. So then in relation to ISO 9001, if you're already certified to ISO 9001, you already have one set of, as long as it pertains to the biobanking activities that impact on your scope, the declared collections, biological material and data collections, then you're already you're a good step along the way. And even if you don't have a certificate to 9001, you can actually, you most likely, I mean, if you have SOPs, policies, different work checks, checklists, etc., already in place, you already have the quality elements relevant to a documentation system. You may already control for some risk. You may already have some elements of quality and other elements that you just need to formalize and understand that you're actually perhaps already doing a lot of this, or maybe it was in the back of your mind that maybe you need to address this. So in a lot of the situations, it's a case of either you already are heading that direction, or you already have some elements in place. So it slots in really neatly with any of those ISO standards if you already have them in place. I will also just refer you to Annex C at the very back of 20387, which explains a little bit more about the quality management system that can be put in place and whether you need to have and how you can apply quality management to show demonstration that demonstrate that you're conforming to that requirement.
Thanks. And just to clarify, I suppose, for the initial assessment at least, the assessment team will be going through all the requirements of the standard, just to make sure that they're implemented and the quality system is implemented fully, at least in the initial assessment. It would be dealt with at that stage. So hopefully that's answered your question.
Sorry, Britt. Can I just add one comment? It's Pradeep here.
Yeah.
So I agree with what Emma and Maurice have talked about the very standards. The critical elements of the 20387 is also in terms of the human material, the informed consent. We need to see that element of the informed consent processes, the application for the information to the patients and so on, if when collecting material for the biobank to be in place. And the other bit is about the distribution side, such as the material transfer agreements and so on, when releasing material, distributing material from the biobank. So those are the elements that are very specific to the biobanks as compared to the other standards like 15189 and so on.
Thanks, Pradeep. Yeah.
Thank you, everyone. So another question has come in. Is there a diagnostic checklist in accordance with ISO 20387? So that might be one for our technical assessors.
Well, I take this Emma here. There isn't, I'm not exactly sure what you mean by a diagnostic checklist, but there isn't a formal checklist yet as far as I understand, within the working group, there isn't a plans to develop one. I think it was recognised that application would be challenging for many different biobanks because there are so many different types of biobanks around the world across all sorts of domains. So I think rather than doing that, I think it was, you know, there are certain elements and recommendations that may not be applicable to your biobank. But if they are applicable, they will really offer great value through implementation. So it's very, very difficult to create a diagnostic checklist that would be applicable across all species domains.
Okay, thank you. So we have another question then. I think this will be for Sean. Software seems challenging even in 20387 manual. It isn't very detailed, so as Sean said, software can affect the fit for purpose. What would you advise for this issue? So I suppose we do want to avoid getting into anything too specific here, but do you have any general guidance, Sean?
Sorry, could you just repeat that, Joanne?
Yeah, sure. So software seems challenging even in ISO 20387. It isn't very detailed. So as Sean said, software can affect the fit for purpose. What will you advise for this issue?
So I suppose it may be more related to your data collection than your biological material, but where it affects your fitness for purpose. So if the fitness for purpose for your biological material or data could be affected by software, you have to look at what that software is doing and then validate the output of that software. So it can be as complicated or as simple as it needs to be, depending on what it's doing. I'm afraid we can't be too specific without knowing a particular example, but yeah, it would be a validation or a verification, again, as you would with an piece of equipment or a method or a process.
Perfect. Thank you, Sean. A question from someone who submitted a question via email who couldn't attend today. So, Breach, is there an estimate of how long the application to the accreditation would typically last? Is there a timeline or an approximate number we could give?
Well, it does depend on the organisation themselves a lot. Once you apply to INAB, I suppose that's when it starts for us, and you know, when you apply through our IT system, and from that we would aim then to have a visit and an assessment with the biobank within 3 to 6 months. And then I suppose it depends on any issues or non-conformities or gaps that we'd identify at that stage, and the time involved with the organisation and the biobank to implement any changes or improvements that are necessary to meet the essential requirements. And then, you know, the assessment team would assess those and make sure we're all happy with the closure of those. I suppose a typical, you know, if we look at a laboratory, for example, this is a totally new area for us, but if we look at a laboratory, you're typically talking a year to 18 months to 2 years from the initial application, you know, and some are within a year to award of accreditation. So, and that would be probably on the shorter side, with it ranging from there up to 2 years. But again, it really depends on the biobank itself and the issues that the assessment team might find when we do our on-site assessments. Sorry, it's not a more defined answer.
Thank you, Breach. So I'm just doing a final check for any last minute questions.
Sorry, Joanna, I might just clarify just a comment there around the BBMRI network biobank is working to ISO 20387. So they're not accredited as far as I know, and I know there may be a lot of biobanks that are, hopefully working according to ISO 20387, but they're not accredited at this point. Sorry, just wanted to clarify. I saw it coming up on the Q&A there. Thanks, Joanne. Sorry for interrupting you.
No, you're fine. I suppose I just wanted to mention if there are any further queries, people might think of something after we close off for today. So feel free to submit any other questions or queries you have to inab@inab.ie or through the Contact Us feature on the INAB website as well. So we do actually have a question, a new question from Emily. So given the importance of data protection and compliance with GDPR in the area of biobanking, does INAB have any views on GDPR accreditation to complement ISO 20387 accreditation?
It's not part of the ISO 20387, but if you go back to I suppose the start of the presentation there, we do take legal requirements into account when we're assessing organisations, and that will include GDPR where it's applicable. And the requirements around GDPR will be taken into account during our assessments. So hopefully that clarifies that for you.
Perfect. Okay, so another question. I'm not too sure. So I think it's regarding the use of Excel for data collection. I'm not too sure on the actual question, if the sender wants to maybe elaborate on their question.
Maybe it's Excel as opposed to a more complex software solution. I'm not sure. Maybe that we can maybe go with that. I'm not sure if that is the intention of the question. Sean or Emma, do you want to take that? Sean, maybe?
Well, I suppose in terms of if we're talking about validation or verification in terms of Excel, it wouldn't be so much that, because the Excel, you're using it, you're just verifying that it's going to be, that it works as it should. But what would be important is your backup and data security. If anyone wants to add to that.
Hi, sorry, this is Hugh here. Padma asked her that question. I've unmuted you if you want to elaborate yourself verbally.
That would be useful. Okay, I'm not sure if
that might have answered Padma's question.
Okay, that's fine.
So Padma, maybe you can get back to us if you need any further information on that one.
So I suppose actually maybe it's just worth pointing out maybe there is that question about whether biobanks need to move to more formal and perhaps even more expensive information systems, and I think it's important to ensure that, as Sean has already alluded to, that the correct securities are in place, that access is restricted to those who need it only, and that you consider the required input for your biobank, as opposed to then maybe things like the training required, implementation of financial resources needed for more IT supported or even IT based systems. So I suppose it's about being able to take the story right through, not only just for your data. So is that just recording your biological materials, specifically associated data, or such as epidemiology, clinical data, or is it also recording the quality of the biological material as well? And in that case, do you have a system that can also record non-conformances and help you right through to dealing with those right through to the end? So it literally depends on the biobank as to what sort of resources are available, as to what elements they choose to work on. And ISO 20387 is applicable to all types of technology usage or otherwise.
Thank you. So a question from Aisling, more of an administrative question. So will the slides be available from this webinar?
Hugh here, I can take this question. Yeah, the recording and the slides should be available. I'll drop the link into chat now. They'll be available in the coming days. It'll probably be Monday before they're available. I just need to do a bit of post-processing, etc. But yeah, if you take a note of the link, I'm about to drop it into chat, and then just check the website from Monday morning. They should be there for you.
Thanks, Hugh. So a question from Fergal. The accreditation to ISO 20387 standard was mentioned as being voluntary at the moment. When is it likely to become a mandatory requirement?
At the moment, we don't have any visibility of it ever becoming a mandatory requirement. It may do, but at the moment, it isn't a requirement and it isn't mandatory for any of the biobanks. I suppose what we're trying to do here is, I suppose, encourage biobanks that are providing material for research purposes, and that it is an internationally focused effort to try and harmonize and ensure that it improves, hopefully, the systems that are in place to provide good research material. But at this stage, it isn't a mandatory requirement, but it may do in the future, but we don't have a visibility on that yet.
Thank you, Fergal, and thanks for all of the questions. I'm not seeing any new ones, but I'll just give it another moment. Just to point out that Hugh has posted the link where we will find, or where you will find next week, the presentation and the slides. So just to make you aware of that. Perfect. So we're getting some comments. Just thank you for the event and that it was very informative and supportive. So thank you for your comments. Again, just a reminder, if there are any further queries or questions, that you can email us at inab@inab.ie, and also there is a contact us feature through the INAB website as well. I think we might have addressed all of our questions.
Oh, that's great. Okay, we're just bang on time, 12 noon. From my own point of view, I'd really like to thank Emma and Sean for presenting. Thank you very much. And for Maurice and Pradeep also for giving their inputs through the panel. Thank you very much for that. And also to Joanne, who has been a huge help in preparing for today and also fielding the questions. Thank you, Joanne. And Hugh, whose camera isn't on, I think he's shy this morning. Thanks to Hugh as well. Hugh has set up the entire webinar, and hopefully it's all run smoothly for all of you. Thank you, Hugh. And again, I think that's it from all of us. Thank you again for your attention and for attending this morning. And again, hopefully we'll meet some of you at least in the future, in the near future, in person. Thanks again. We can sign off.
Thank
Goodbye.
you.
Thank you.
Bye-bye.
Bye-bye.
Thank you. Bye.
Bye-bye.